It's an honor to introduce our distinguished speaker, Dr. Rahul Prince. He is currently working at JSS institution and serves as the head of the Department of Yoga. With over 3 years of experience in the field of naturopathy and yoga, Dr. Rahul has been actively involved in promoting natural health and holistic living through his dedicated work and academic contributions. Today, on the third day of our webinar series, organized to mark the 8th Naturopathy Day, he will be delivering a talk on the most common and concerning health issue, diabetes. His session will focus on understanding diabetes and how naturopathy and yoga can play a vital role in its prevention and management. Let us warmly welcome Dr. Rahul Prince to enlighten us with his valuable insights. Over to you, sir.
Good morning. On behalf of JSS INOS, I would like to welcome you for the webinar series on diabetes mellitus and management through yoga and naturopathy. So, we all know about diabetes mellitus. Daily, we are keep on hearing on diabetes mellitus. Daily, we discuss, or daily we hear that my mother is having diabetes, my father is having diabetes, my grandfather is having diabetes. But we doesn't know what is diabetes mellitus and how it occurs and what is the etiology, what is the causative factors. We doesn't know. But simply we say my father is having diabetes, my mother is having diabetes, I'm going to the hospital, I'm taking medications. But today we are just going to discuss on how naturopathy and yoga helps in treating diabetes. It's not about treating how to reverse diabetes with the help of naturopathy and yoga. First, we'll see what is diabetes mellitus. Diabetes mellitus is a metabolic disorder where there will be increase in sugar levels in the blood. When it is not treated properly, automatically our organs get distracted or destroyed, like eyes, kidneys, nerves, heart, vessels, everything get destroyed. So, what is the major reason and what is the associating factors? We'll discuss. See, when we see the epidemiological report, India is called as the diabetic capital because 69.1 million of people are diagnosed with diabetes. Daily patients are getting diagnosed with diabetes. When we see the classifications, what are the different classifications we have in diabetes? Is type 1 diabetes, type 2 diabetes, and gestation diabetes. What is type 1 diabetes? Type 1 diabetes is because of insulin deficiency. It's because of when pancreas is not functioning properly, when beta cell is getting distracted, automatically there will be no production of insulin. Automatically, it is called as type 1 diabetes. What is type 2 diabetes? Type 2 diabetes is there will be production of insulin, but it's glucose will not enter into the cell. So that is called as insulin resistance. That is called as type 2 diabetes. Next is gestation diabetes, which takes place in maternal mothers. So how diabetes happens and what is its pathology, we'll see in a simple manner. See, diabetes is increase in sugar levels. Why sugar level is getting increased? When we see this picture, we are eating idli, we are eating dosa. So idli dosa is in the form of carbohydrate, it converts into glucose. So this glucose has to enter into the cell. Why glucose has to enter into the cell? When the glucose enter into the cell, we'll get energy. We can able to work. We can able to do our actions. We can able to do our daily physical things. But when the glucose is not entering into the cell, we'll feel tired. We feel lethargy. We can't able to do the work. We can't able to read. These are all simple things. Why insulin is not entering into this? It's because of fast food, not controlling the BP, smoking daily, obesity, and sedentary lifestyle. When we are having keep on eating fast foods, not practicing proper diet, when we are not controlling the BP, when we are keep on smoking, when we keep on taking alcohol, when we are not controlling the weight, automatically what happens is there will be resistance. What is resistance? Insulin will not talk with our cell. When insulin is not talking with the cell, automatically glucose will not enter into the cell. When glucose is not entering into the cell, automatically blood will be having more amount of glucose. When blood is having more amount of glucose, automatically the problem arises. Okay, what is the causative factor for diabetes mellitus? Is genetic because of pancreatic disease, drugs, infections, etc. Okay, what is the symptoms of diabetes mellitus? See, when patient is diagnosed with diabetes, they'll be having symptoms like frequent urination they used to have. They will be keep on eating something like they will feel hungry always, and they will be having thirst always. They used to drink water. Why the symptom arises? What is the link between frequent urination, frequent hungry, frequent thirst? What is the main reason is, see, when blood is having more amount of glucose, the properties of glucose is it takes water in. That is called as osmotic property. So automatically what happens is water is getting increased inside the blood vessel. So what happens? So when water is getting increased, automatically cardiac output get increased. So because to reduce the cardiac output, automatically what kidney does is reduces the water. So automatically there will be more urination. First symptom. Second symptom is, see, first I said in diabetes mellitus, glucose will not enter into the cell. When glucose is not entering into the cell, automatically cell needs energy. When there is no energy, automatically your brain cells detect that they have to eat something. So automatically they'll be having more amount of hungry. So when more amount of water is going out of the urine, so what happens is patient is will be getting more amount of thirst. So the symptoms of diabetes mellitus is frequent urination, frequent hungry, and always they will be having the symptom of thirst. Okay. So allopathy doctors usually says that it's because of poor lifestyle, obesity, hypertension, uh, uh, stress. What naturopathy says about diabetes mellitus? According to naturopathy principles, when you see it in a clear manner, diabetes mellitus is because of stress. What's the link between stress and diabetes mellitus? But there is no direct link between stress and diabetes mellitus. But when we see the research evidences, stress is a major role for diabetes mellitus because when people is getting more stress, automatically cortisol get increased. When cortisol is getting increased, automatically it damages the pancreas. When it's damaging the pancreas, automatically insulin resistance happens. When insulin is getting resistant, automatically glucose will not enter into the cell. That is called as diabetes. So naturopathy principle says stress is the main factor. Poor diet, inactivity, environmental stress, all can lead to diabetes mellitus. Second is dysbiosis. See, nowadays we are keep on eating many unwanted foods, fast foods, colored foods, white sugars, everything. So what happens when you keep on eating something which is not accepted by the human body? Automatically what happens is good bacteria get distracted. When good bacteria are getting distracted, automatically bad bacteria's growth get increased in the gut. So when bad bacteria's growth are getting increased in the gut, automatically inflammation is getting increased. Why inflammation happens? There is an interleukin that is called as interleukin 10, which is produced in the gut. That is called as anti-inflammatory. See, when there is no good bacteria, when there is high amount of bad bacteria, there will be no production of interleukin 10. So when interleukin 10 is not there in the gut, automatically inflammation get increased. When inflammation is getting increased, automatically it leads to insulin resistance. That insulin resistance, automatically glucose will not enter into the cell. When glucose is not entering into the cell, so it will be end up in diabetes mellitus. Okay, so these are the major things. And naturopathy says reduce the stress, have a proper diet protocols, go for exercise, do yoga, have a peaceful environment, have eat healthy foods, not junk foods or white sugars, or avoid maidas and reduce the inflammations. When we practice these concepts, automatically we can able to reverse the diabetes mellitus. See, when diabetes is not control, what happens? When diabetes is not controlled, automatically there will be damage to our eyes, there will be damage to our kidneys, and there will be damage to our nerves. That is called as diabetic retinopathy, diabetic neuropathy, and diabetic nephropathy. Why this complication happens? See, you are saying, doctor, simply blood is having more amount of sugar. Then how it damages eyes, our kidneys, and nerves? When we look very deep into the cellular mechanisms, in diabetes mellitus, what happens is when there is a more amount of sugars in the blood, automatically the sugars bind with plasma proteins. When sugars binds with plasma proteins, automatically it produces a compound called AGEs, that is called as advanced glycated end product. Okay, so when advanced glycated end product is produced, wherever this advanced glycated end product settles, automatically there will be damage. When it stored in the eyes, automatically eyes get damaged. That is called as diabetic retinopathy. When it settles in kidney, automatically it will be end up in diabetic nephropathy. When it settles in nerves, automatically it end up in diabetic neuropathy. So automatically, when we are not controlling diabetes, when we are not following the strict protocols of diet, stress, we are not controlling the stress, we are not in a healthy environment, automatically sugar levels get increased. When sugar is getting increased, automatically there will be production of ages that is called as advanced glycated end products. Then it leads to complications. These are called as diabetic retinopathy, diabetic neuropathy, and diabetic nephropathy. Well, these are the basic things. How to handle this diabetes mellitus through yoga and naturopathy. So yoga and naturopathy treats patients as a holistic system of medicine. So it will not treat only diabetes, it treats the whole body, mental and physical well-being. So we'll discuss how this diabetes mellitus can be managed through yoga and naturopathy. So we have many therapies in yoga and naturopathy. So what treatments will be helpful for treatment of diabetes and reversal of diabetes is first we have a treatment called hydrotherapy where we treat the patients with water. Second, we have a therapy called diet therapy. So we focus with the healthy diets where we can reverse the diabetes mellitus and we can reduce the sugar levels in the blood. Third is chromotherapy. With the help of the light, we can able to it is a chroma is color. With the help of the color, we can able to decrease the sugar levels, and with the acupuncture, we can able to have the good well-being of the patient. The massage therapy, we can able to reduce the sugar levels, and with the yoga therapy, we can able to manage the diabetes. So this with this holistic approach, we can able to reverse diabetes, and we can be able to control the diabetes. So the well-being of the patient will be improved. So how this therapies helps. So first is hydrotherapy. So while we do hydrotherapy for patients, while we give hydrotherapy to the patients, automatically the physical well-being and mental health in diabetic patients will be improved. Why this physical and mental health in diabetic has to be improved? See, when a patient is diagnosed with diabetes, automatically what happens? There will be a strict protocol that they should take tablets daily. So if they miss the tablet, automatically sugar level increases. They'll be end up in some problem. So what happens? Mentally they are weak and physically they are unhealthy. So to improve the well-being of the patient, this either hydrotherapy treatments helps in improving the mental health and physical health. So second is how this hydrotherapy helps in treating diabetes. It boosts the circulations and it boosts the metabolism. And what happens is this glucose uptake gets improved. See, in case of diabetes, first I said the glucose will not enter into the cell. So that to reduce the insulin resistance, when we give the treatments which is related to water, automatically this glucose resistance get decreased and glucose enters into the cell. So nearby we can reduce the sugar levels in the blood. Next is last is stress reduction. See, according to naturopathy principles, we say stress is a major factor for diabetes mellitus. So stress reduction is major focus in hydrotherapy. So when we give hydrotherapy treatments to the patients, automatically stress gets reduced. So hydrotherapy works, does wonders in treating diabetes mellitus and in remission of diabetes mellitus. Second is chromotherapy. We'll be wondering how this simple color treats diabetes mellitus. See, we are sleeping in a room. The room is full of light, bright lights. Will we get sleep? No. Why we are not getting sleep? When light is off, automatically we'll get a sleep. That is called as melatonin. See, when we want to get melatonin, we should be in the dark light. So the darkness stimulates the melatonin. Like that same way, this orange color automatically enhances the pancreatic functions. The research says when we give this orange color or when we give yellow color based waters or treatments or therapies, automatically it stimulates pancreas, it stimulates the metabolism, so we can able to reduce the sugar levels in the blood. So chromotherapy also helps in treating diabetes mellitus. And we have a therapy called massage therapy. How massage helps in treating diabetes mellitus. So naturopathy approaches always says it's because of stress, and it's because of anxiety, it's because of tensions. So when you give massage therapy, there will be production of happy hormones. This happy hormones reduces the level of stress hormones. When the stress hormones is getting reduced, automatically cortisol level decreases. When cortisol is decreases, insulin resistance will be decreased and sensitivity gets improved. So automatically glycemic control can be achieved. When a patient is having high level of sugars, like sugars in the blood, so when we give massage therapy, there will be glycemic control. When glycemic control is achieved, automatically long-term treatment of naturopathy can able to reverse the patient and must in diabetes mellitus. See, when we are not controlling the diabetes mellitus, what happens is we'll end up in complication that is called as diabetic neuropathy, retinopathy, and nephropathy. So when patient is having numbness in the legs, automatically what allopathy doctors used to give, simply they used to give some painkillers. But in naturopathic, we used to stimulate the nerves with the help of massage. So like stimulating the nerves, blood flow can be improved with the help of massage therapy. So diabetic nephropathy complications can be reduced with the help of massage therapy. So we have yoga therapy. See, yoga therapy is a major therapy where we can able to reverse the patient with diabetes mellitus, or we can able to reduce the glycemic control in the case of diabetes mellitus. So what happens, how yoga helps in diabetes mellitus is it decreases the glycemic, it improves the glycemic control, and insulin sensitivity gets improved. That is called as it able to send the glucose inside the cell. Automatically what happens is yoga therapy reverse the patient with diabetes. So how yoga therapy helps in diabetes mellitus is reduces stress, depression, anxiety, and promotes neuroendocrine balance. What is neuroendocrine balance? If a patient is diagnosed with diabetes, they'll be keep on taking metformin for years together and years together. Like they used to take metformin, glimepiride, glibenclamide, etc., etc., etc. So what happens is, like some duration of period, this insulin secretion get decreased. When the insulin secretion is getting decreased, automatically there will be no insulin. They'll be end up with taking insulin injections. So to reduce that, it improves the endocrine, that neuroendocrine balance. So overall well-being of the patient will be improved. So we have many asanas, we have many pranayamas which helps in treating diabetes. So for example, we have Sedu Bandhasana, we have Bhujangasana, Trikonasana, it directly acts on pancreas. So well-being and emotional well-being of our patient will be improved with the help of yoga therapy. Okay. Next we have a therapy that is diet therapy. See, recent days, but in case of diabetes, many people used to follow something they read in their books or YouTube or etc. etc. But they doesn't follow what doctors says. What doctors says, see, what is the typical food we daily take in the diet is morning we used to have some carbohydrate, lunch we have carbohydrate, and dinner we have carbohydrate. What is carbohydrate is like morning we take idli, lunch we take rice, night we take once again idli or dosa. So we doesn't have fat or we doesn't have proteins. So what happens when you take idli? Within half an hour, idli gets digested. Automatically, sugar level get increased. But if you take protein, the digestion gets increased. So the gastric emptying, we say that is gastric emptying. The gastric emptying will be prolonged period. So if you take sugar like carbohydrates, automatically sugar spikes. Faster spikes, automatically it will be end up in some complications. So reduce carbohydrates and increase the intake of proteins and increase the intake of fats in case of diabetes. But are we following it regularly? No. How? What is the diet we follow? Idli dosa rice, idli dosa rice, idli dosa rice, or we'll go for chapati. So how our diet should be and what is the principle we should use in case of diabetes mellitus is vegan based diet or called vegetarian diet. How we should intake is like whole grains we can take, legumes we can take, fruits we can take, or vegetables we can take. These compounds which has phytonutrients helps in treating diabetic complications. So we have complication. I said when sugar level is keep on increased and it is not in control, automatically sugars binds with plasma proteins. They produces ages. That is called as advanced glycated end products. These advanced glycated end products, wherever it gets settles, it causes complications. That complication, that ages has to be reduced only with the help of, it can be reduced with the help of phytonutrients. So this phytonutrients is rich in grains, legumes, fruits, and vegetables. When you take more amount of fruits and we take more amount of vegetables, automatically diabetic complications can be prevented. See, as a doctors, we say take fruits, take vegetables. What you do is you in the lunch you take rice, you take dal, fine. Once you are completing the lunch, automatically you will take 1 cup of fruits. So carbohydrate itself is going to raise the sugar level. Automatically, if you take the fruits, sugar level gets increased 2 times. Okay, so how to take the fruits and how to take the rices? If you want to take fruits, you take 1 bowl of fruits, or if you want to take rice, you take one cup of rice. But don't mix fruits and rice. Automatically, sugar level increases. See, so these are the simple things we should do to improve the metabolic health of the patient. Second is healthy foods. What is healthy foods? What we do simply morning we take 1 cup of milk with two spoons of sugar. Is it healthy? No. So how we should take the food is the food should not cause any stress to you. Food should not cause any anxiety to you. The food should not cause any emotional dysregulations. So you should be very cautious. Take sattvic based, bland based, simple foods. Just chew it, take a happily. So automatically what happens is when you chew and eat the food slowly, there'll be no increase in sugar levels. But when you're eating it very fast, that emotional eating, automatically what happens when you're in stress and we are eating the food, automatically sugar level increases. Because of that, complications starts. So next, what we can have is we can take nuts, we can take seeds. So these compounds automatically reduces oxidative stress. What is oxidative stress? See, in a cell we have a we have a structure called mitochondria. Whatever the food you eat, it will be converted to glucose. That glucose enters into the mitochondria, it produces ATP. That is called as adenosine triphosphatase. That is because of that ATP only you work, you read, etc. But what happens is when you eat unhealthy foods, when you are eating white sugars, when you are eating colored foods, when you are eating junk foods, automatically ATP will not be produced. It produces some compounds called free radicals. So the free radicals automatically causes damage to the cells. So to reduce that oxidative stress, we can take nuts, more amount of seeds like pumpkin seeds, sabja seeds, flax seeds. These compounds automatically reduce oxidative stress because they are rich in antioxidants. These antioxidant compounds decreases the diabetic complications. How to eat the food and what is the pattern we should follow in eating food is we should try to eat the foods in the raw based manner, like raw salads you can have, uh, fruit salads we can have, boiled vegetables we can have. These improves the digestion and reduces the gastric emptying. But if you take the full amount of carbohydrates, gastric emptying will be increased faster. Automatically, what happens? Sugar levels get increased. So pattern has to be maintained, and eating timing has to be maintained, and the compounds like fruits, nuts, seeds, vegetables, legumes, grain can be added more in the diet. So automatically glycemic control can be stopped. So what we are focusing today more on is hydrotherapy treatments, diet therapy treatments, chromotherapy treatments, acupuncture, massage, and health psychological counselings. So with the help of these managements, automatically we can able to control the sugar levels. See, another thing, the main focus here is, are we taking more amount of fibers? No. Why we are not taking more amount of fibers? Are we taking vegetables more? No. Why we are not taking more vegetables? Because of this fast scenario of life, what we are doing, we are forgetting about our health, our mental health and physical health. We are running towards our job, we are running towards earning money, etc. etc. But what end of the day, what happened here? End of the day, what happened here is people are not satisfied with their mental health and physical health. When they are not satisfied with the mental health and physical health, automatically it end up in disease. So how to focus more on mental health and how to focus more on physical health is first to improve the physical health of the human being. Automatically they should go with more amount of they will do regular exercise, walking, yoga, pranayama. This improves their mental, like physical well-being. How to improve their mental well-being? Talk with the friends daily. Spend time more with your friends daily. Go for get-togethers. These things reduces stress, and the mental well-being and physical well-being of the patient will be improved. So at the end of this session, I'm just focusing more on uh, daily regular habits. These simple daily regular habits, if you change it, automatically the well-being of the patient gets improved. How to change the regular daily habits? We usually wake up at 10 o'clock, 11 o'clock. But when to wake up? You can wake up at 6 o'clock. Daily you can go for walking, you can go for jogging, you can do some yoga, you can do some pranayamas. What happens? The physical well-being is improved. But we are if you waking up at 8 o'clock, then what we will do? We'll be rushing up, we'll be going fastly, we'll be taking bath, fastly we'll be having food. So what happens? The mental well-being is decreased, physical well-being is decreased. It is not proper. Automatically we are pushed into the state of disease. See, if you are not taking the health properly today, then you are going to invest the full body in the hospital. So now you start investing your full things in your physical well-being and mental well-being, and and later on avoid going for hospitals. So today we have discussed about more on diabetes mellitus and its how to manage it through yoga and naturopathy and its treatment aspects. So simply I am just brushing up. We have two types of diabetes, type 1 and type 2 diabetes. And if you are not controlling the diabetes, we'll end up in complications like diabetic retinopathy, neuropathy, and diabetic nephropathy. So what to do is avoid junk foods, control your BP properly, reduce your smoking, control the weight, and improve your lifestyles. So because of that, we can able to improve our full well-being of the human being. Thank you.
Thank you, sir. That was a wonderful session. And diabetes is a rising concern in India in all different economic levels. And the way the diabetes can be managed is through hard effort. And your session was very informative in making that effort much more easier. And more the informative the session was. So thank you, Rahul sir, for your wonderful session. Thank you, sir. And we'll be continuing with the upcoming sessions in our webinar series, and keep following our page. Thank you all.